Good afternoon, this is Barbara Ochester, and I am doing my signature assignment, Module 8, for Introduction to the Dissertation, Dr. Michelle Whitman. I had the opportunity to critique a particular dissertation, and it was interesting because it was very similar to the subject that I am going to be studying. This dissertation was called From Getting High to Getting Well, and it was done by Dr. Michelle Newhart. Dr. Newhart looked at a group of patients in Colorado in 2012 and actually looked at how they integrated the use of medical cannabis into their life. Her research question was, are people able to normalize cannabis use and integrate it into their life and take it like any other medicine? There were some surrounding issues with this particular dissertation, just in terms of other questions that could have been asked, and she brought them up in the conclusions, limitations, and where we could go from there. The importance of this particular dissertation to me certainly is as important as it gets, since I have truly seen and learned about people that do well when they use medical cannabis for specific criteria and symptoms, and they use it on a legal basis, so we are able to really determine what's in the product and if that is going to be the combination of either terpenes and cannabinoids and varieties that are going to work well for them. And I think that the importance is that to note that it was done in 2012. It's now 2019, 7 years beyond when she was doing her study, how much progress we've made and how little progress we've made. And I will explain that a little bit more as we go on. The very first part of this is to do the introduction, to really talk about her question, and also just reiterate the importance of this particular study. She introduced it as really looking at how people normalize their use of cannabis into their life as if it were another medicine. Her question was, can you routinize it? Can you make it a part of your life? Is that the way that people use cannabis? And do they feel comfortable with that? And certainly the importance, I could go on for hours about the importance of it and the people that I've seen get better, but suffice it to say that it is now very apparent that medical cannabis is valuable as a medicine. Clearly, there are still people that really believe in recreational medicine. I am not one of them. This is not a field that I would want to work in. But in terms of people who use it for medicine, who get themselves registered and use it legally for medicine, I think this is great importance. Individuals have come to the end of their therapeutic ropes in many instances with traditional medicines. Either they've been taking medicines for so long that they either don't work anymore, they've become really tolerant to them, or the side effects have become intolerable. This is why I think that medical cannabis is so important, because many of us have gotten to a point in the traditional pharmaceutical world where things don't work any longer, or the side effects are untenable at this stage. So those are the reasons that it's very important, and I think that she had an inkling of just how important this research could be back when she did it in 2012. Her methodology was really interesting. This is a woman who really knew about cannabis because she had previously lived in California, and a completely different perspective on medical cannabis there. But when she moved to Colorado and began doing her work, and she was in the Department of Sociology, so she wanted to look at the sociological aspects of how people take medicines. But as she began to look, she knew that she would really have to get herself well connected in the state. She had been well connected in California, but she needed to be well connected in Colorado. So she went to advocacy meetings and legislative meetings, open town hearings, all of the different political meetings as they were trying to get the bill passed. This is before Amendment 64 passed, which was the recreational use, and so it was just medicinal when she was there. She also went to a number of dispensaries, certification doctors, just to find out what kind of people were coming in and trying to get their medical cannabis certification from their physicians. One little side note on this is the number of physicians that sort of pop up in order to do certifications. It's sort of like a doc-in-the-box kind of arrangement, and it's a money-making scheme, which is really just completely massacres the credibility of the medicine, but it happens in every state. There are doc in the boxes that do certifications everywhere. But nevertheless, those docs who really consider patients and do it well, help them understand what might help and what might not help if they're a candidate, are the ones that you really want to go to. So her methodology was to get to know as many people that were had any connection to cannabis in the state. And she did that, and she spent several months doing that. She did this in order to learn what was going on in the state and whether or not she actually had a valid question, but she also used it to understand where she was going to get her recruitments from. She actually recruited people anonymously. They had to opt into her study. They couldn't just sign up. They actually had to come and have a conversation with her and talk to her about what she was looking to ask them and to determine from them. And once they opted in, she began to do interviews. Her introductory interviews were really sort of looking at how people incorporate cannabis taking into their lifestyle, how they're taking it, how they schedule it, how they understand whether or not and learn whether or not it's working for them. Does journaling work for them? And this is what I'm going to study in the future about journaling and whether or not this really helps people understand what their perfect dose is more quickly than if they just experiment. And she determined very early on that the way that young people under 40 introduce cannabis into their life is very different than the way the middle-aged folks, and I'm assuming from 40 to 60, or maybe even 69, since that would include me in middle age, and how they incorporate cannabis into their life. And it's very different. And so she decided to really focus on the middle age, and probably for this study's purposes, it was 40 to 60. So she did in-depth interviews with these folks to determine how they got their card, what their criteria was, if they felt comfortable or stigmatized against during the time that they were using, if they share it with their friends, if they share it with their family members, and like they would anything else. Oh, I started on Lipitor today. Well, do you say the same thing? I started on cannabis today. And how comfortable people feel about that. Once she had interviewed about these first few people, she realized that she really wanted to stick with this particular age group, and she interviewed 40 folks that were in this age group to determine whether or not they were able to integrate cannabis into their lifestyle. Her results were very interesting. In fact, people do integrate it, but they still feel a great amount of stigma. There is still a huge cohort of people who believe that cannabis is a gateway drug, when in fact more and more evidence says that it is a gateway drug, but it's a gateway to getting off of opioids and off of opiates that you were addicted to, and no longer a gateway to get to those products. Many people come to my dispensary, just as a side note, that are addicted to opiates or are trying to get off of opiates and just are not being successful with it, and have heard that cannabis might help. To my knowledge, there is only one state that actually takes opioid addiction refractory to other medicines as a criteria for getting a medical cannabis card, and that is my home state of Pennsylvania. I work in Maryland, but I live in Pennsylvania, and I'm very, very pleased that the governor of our state chose to add that to the criteria that so people can get their cards. The interesting thing about cannabis is it will mitigate the withdrawal symptoms at the same time that it is taking over for the pain relief that the patient needs. It keeps you from being nauseous. It really quells the belly pains that are two symptoms of withdrawal from opiate addiction. So that's a really important thing. She wanted to know, were they stigmatized? And this is Dr. Newhart. So she wanted to know, did they still feel some stigma? Did they share this with their families? And the results are that people still feel a great deal of stigma, feel like they are really ostracized if they happen to be a cannabis smoker in some crowds, don't feel like they can share this with their family, don't feel like they could share it with some of their physicians. And many opt to go to a physician who just certifies and not their own doctor. One of the things we have to remind patients, and the importance of this, is if you do use cannabis, you want to be careful if you're on Coumadin or other warfarin products, because it prolongs your bleeding time. And you want to be careful if you're having surgery again, and want your anesthesiologist to know that you are using cannabis, because it will take much less anesthesia to accomplish the same level of sedation for any kind of surgery you have. So those were the results. The conclusions are really interesting for her as well. And as you can tell, I was very interested in this entire study. Her conclusions are that we've got a long way to go. And I think that I totally concur with that. I think we do have a long way to go, but we also have to remember that 34 states are legal now, at least for medicinal use. I believe 9 or 10 are legal for recreational use. The rest of us are right in line, which does not make me as a researcher happy, but recreation is going to happen here very soon in a number of states. I know New Jersey, Pennsylvania, Maryland are all considering right at this moment. So her conclusions were that there's a lot more study to do, that we really want to figure out a way to distinguish people who use it as medicine, how they integrate it into their life. We want to make sure that people really understand that this is a medicine, this is not a recreational tool. And there are many who do understand that. There are many who do understand that diversion can be a problem, and her conclusion was diversion can be a problem because you get it legally and you give it to somebody who doesn't have it legally, and that can cause a problem as well. And so I found this a valuable dissertation. I am sure this is not the last time I'm going to look at this. I have written her, wanted to talk to her a little bit one-on-one if I could. First to tell her what a great dissertation it was, and she did it so long ago, and I think it was a really brave thing to do, to look at it, even if you're looking at the sociological aspects. And I think that it's something that I have gotten a little bit of pushback from people. Why would you want to study that? How can you possibly work in that? Do you have free samples? Which is a question, my most frequently asked question when I'm in a social situation. But in general, I think that her conclusion was exactly as mine is. We've got a lot more studying to do. We've got some limitations because these were medical patients that were really committed to taking the step to get certified and then using medicine, and whether or not they could integrate it into their life as a routine medicine, just as they would any other one. And if they're able to get off of other medicines, which is one of the goals for many people, is to stop using the opiates or stop using the benzodiazepams, get off of their sleeping medicines, get off of their antidepressants. And because we know that CBD releases a tremendous amount of serotonin, that in fact people do feel better, and whether or not this was a criteria is almost irrelevant at this point. People come in and tell me they're using it for depression, and I always say to them, what did the doctor certify you for? And it will be pain. And so they may not be being certified for exactly what is ailing them, but they have found that cannabis really helps them with the ailment they are trying to treat. Thank you very much for listening. I could go on for hours. I won't. But Dr. Whitman, you and I can certainly talk about multiple sclerosis in particular. I did pull about 10 articles or so, which I'm going to mail to you, and we'll go from there. Thank you so much.